of the process to bring your young person, your son, daughter here to the University of St. Thomas. This is a great place to study. It's a great place for them to be formed and to grow as young people as they are in that process of emerging as adults. In the Center for Campus Ministry, we take our mission seriously. We kind of take our marching orders, if you will, from the document that St. John Paul II issued in 1990. It's called Ex Cordia Ecclesia. It means from the heart of the church. And what he says there is that the Catholic University has a responsibility for the spiritual well-being of all their students. So in our office, we take that to heart, and we have now a very diverse office. You heard me mention this morning before my prayer that we have on our staff a Presbyterian pastor, a Jewish rabbi, as well as a Muslim chaplain who works with our Muslim students. We do programming really across the whole range of faith traditions, along with our Catholic faith, and we think that that's important to be diverse, to be inclusive, to be ecumenical and interfaith, as the slide in front of you says. It's a big task, but what we've seen over the last several years is that more and more students are coming through our door to ask questions about life and to seek us out, which we're more than happy to do. A little bit later, when you go to the information fair, you'll have an opportunity to stop at our table with your student and pick up information about retreats and mission trips and the whole scope of our programming. Thanks again for being with us today. Seriously, if you have any questions, I'll be at the parents' gathering later this afternoon down in Scooters. I'd be happy to talk to you if you've got a particular question about our office. Thanks again. And oh, I'm sorry, and I have to run. I can't stay. I have to run and hear confessions and celebrate Mass here shortly. So thank you.
Good morning, everyone. I meant to introduce myself earlier. My name is Jesse Langer. I work here in the Dean of Students office. My job is to oversee our student conduct process. As you can imagine, that does not make me super popular around here. The students don't necessarily duck behind the bushes and trees when they see me, but they will break eye contact with me right away. They'll walk in a wide path around my path. It's like they think I'm going to think of a funny punishment for getting too close to me or looking at me funny. But punishment isn't our style here at St. Thomas. We are educators here, and so the philosophy behind our student conduct process is to educate. And we get that philosophy from our mission statement, because that word educate comes right in the middle of our mission statement. It says we educate students to become morally responsible leaders who think critically, act wisely, and work skillfully to advance the common good. And so it's my job and the job of others on this campus to hold our students accountable to that mission statement. And we hold our students accountable to that mission statement while they're on campus, and we also hold them accountable to that mission statement while they're off campus. When a student is reported to have violated the student conduct code in the residence halls, we will meet with them. And the person that meets with them is called their conduct officer. And their conduct officer is likely to be the residence hall area director where the student lives. If the student is reported to have violated the student conduct code while they're off campus, their conduct officer will be myself, and I will have a conduct meeting with them. Now, our conduct meetings are guided by our convictions. Each conduct meeting is held with dignity and personal attention for every student so that we can pursue the truth of what happened in each incident. During those conduct meetings, we will talk to the student about their choices. in the context of their values, in the context of the impact they had on other people. We'll talk to them about their choices in the context of the St. Thomas values, and also in the context of their impact on the St. Thomas community. We will also talk to them about what they can do to make things right. Now, our student conduct process uses a restorative justice approach that also falls in line with our convictions. A restorative justice approach treats everybody involved in an incident with dignity and respect. And that goes for those who have been harmed by an incident, for those who caused the harm, and for those who have been impacted by this incident. It opens up a meaningful dialogue so that everybody involved in that incident can understand what has happened from everyone's perspective and to understand the impact of that incident and those choices from all perspectives. We use a restorative justice approach in our student conduct process, as well as in restorative circles and restorative conferences that we have after major incidents on this campus. Now, here at St. Thomas, we value the diversity that everyone brings to our community. And restorative justice is a tool that we use to help educate about the value that diversity brings to our campus and to our community. It helps to educate about the value that those diverse experiences bring so that we can create a more just and inclusive community here at St. Thomas. We have a community of care here at St. Thomas. That means that we have an obligation to the well-being of everybody here at St. Thomas. So that's a broad overview of our student conduct process. It's guided by our mission and convictions.
Good morning. My name is Patricia Conde-Brooks, and I am the Executive Director for Campus Inclusion and Community. So welcome, bienvenidos. So the conviction that I'm going to start mostly focusing about is diversity, which is where we work for a more just and inclusive society. When I was asked to speak in the panel, and they said, "Oh, you wanna? We would love for you to speak about diversity as around convictions." I was thinking about what I was going to say, and this year we decided to do diversity and inclusion a little bit different. What I was thinking about, it brought me back to the roots of St. Thomas. The University of St. Thomas was founded for Irish immigrants in 1885, and our Irish immigrants in 1885 were the othered. They were the ones that weren't able to be educated. They were the ones that were not wanted by society. They were seen as less than. And yet Archbishop Ireland opened his doors and opened the university and offered an opportunity to educate those that welcome the stranger, as we like to think about in Catholic terms. So at St. Thomas, we like to see ourselves and continue to see ourselves to be that university, the university that opens the doors to everyone. And everyone includes the other. Everyone includes our immigrant population, our students that come from underrepresented backgrounds, students that come from a wide variety of places and spaces, because we believe that it's not only part because we are Catholic that we do that, but because it makes for the richer experience for everyone that is here on our campus. So one of the offices that I work with is the Student Diversity and Inclusion Services, which is the office that specifically touches the students. And in our office, we expand what we mean by diversity. And so we not only look at diversity as racial, ethnic, national, but we also look at our diversity, social economical status, sexual identity, political differences. We like to see diversity as bringing all spectrums to the table. And the way that we go about doing this is by looking at our 4 pillars, 4 things that we do within this office. The first thing we do is we provide educational experience for students with a diverse perspective outside of the classroom. We work very closely with our faculty members who are experts in their field or who will bring national experts. We have Cornwell West on campus. We have had Peggy McIntosh. We had Michelle Alexander come on campus to give lectures. But we also have teach-ins. And this is an opportunity where your student, maybe they're majoring in engineering or they're majoring in accounting, and maybe they don't encounter times where they can have conversations about what's happening in our society today. College campus are the macros. It's a reflection of our society. And so last year we had a conversation about Colin Kaepernick, should he have taken the knee or not? It's controversial in our society. Of course, it's controversial on a college campus. But what we like to do is bring people to the table to have a conversation where we can agree to disagree, but we're respectful to each other. We listen to each other's point of view. We look and maybe I don't agree with what you're saying, but I can see where you're coming from. And we like to think that that expands your opportunities for learning outside the classroom and expands and enriches your college experience. So we do that through educating our students. Then we look at leadership. What does that mean? What we'll be focusing on, started last year, and specifically as we're coming forward this year, we're going to be looking at inclusive excellence. And the way we like to think of inclusive excellence is preparing our students to work in a very diverse workforce. Many of our students are going to be working with teams, global teams, and certainly very much racial and ethnic difference in the teams. And what does that mean when I work with someone that comes from a different background? How do I look at my leadership style? I know as a Latina, I tend to look at personalismo, which means I want to have a personal relationship with you, and that's integrated in my culture. And I want that to be valued when I'm working with the team. So we work with our student leaders, and we work with the students to, outside of the classroom, facilitate conversations about what does it mean to be an inclusive leader. Who is part of my student club? Am I making decisions? Who am I including? How am I excluding? And how do we mediate those differences, right? Because diversity is only diversity when it comes diversity. And sometimes with diversity comes differences, and how do we facilitate those differences as we look at leadership? The next part we look at is advocacy. This year, our incoming class is 19% students of color, which means we're a predominantly white campus. And yes, I know many of you knew, or now you're finding out we have had racial incidents on campus. We had a really big one last year that made the media. But it wouldn't be the first time we had a racial incident on campus. So what do? We advocate for students. We advocate for the dignity of everyone and the dignity of treating people with respect. And it will not be tolerated on our campus when we see those incidents happen. And how do we facilitate and how do we bring that so we can have a conversation and where we're respecting everyone that's here? And specifically, how do we advocate from students that come from marginalized, minoritized communities? And how do we make sure that we're all treating each other with respect? And lastly, we like to focus on community. And community is part where we celebrate our differences. Your student won't tell you this, but I'm telling you now. We celebrate quite a few things on campus. We'll celebrate Hispanic Heritage Month. We have Nuestra Noche, which is a wonderful night where we have food and performances. We'll have the Hmong New Year. We'll have Pride Week. We have Black History Month. We have an international dinner that has been going on for over 30 years at St. Thomas. And so our community is invited, not just the students. You're also invited. And we'd like for you to come to campus and celebrate with us and celebrate the community. And most of all, be part of what's going on here on campus. Lastly, as I close, I want to thank you for having chosen the University of St. Thomas, and I want to thank you for the diversity that each and every one of you in this room will bring to the St. Thomas, because it's a diversity that we need and diversity we appreciate. So welcome to St. Thomas.
Good morning. My name is Madonna Mcdermott, and I'm the Executive Director for Health, Wellness, Counseling, and Violence Prevention. And you'll see from the slide, it's soon to be the Center for Wellbeing. We approach the conviction of personal attention through well-being. And so we look at the students' sense of well-being from day one, from today, right through graduation and beyond. And that well-being has to do with their emotional, physical, intellectual, and spiritual well-being. We work very closely with all of our colleagues on the stage, as well as most of the departments on campus. The nice part about it is that we can refer very easily. So if a medical provider is seeing a student that is maybe struggling in one way or another, they might say, what about seeing somebody from academic counseling? It sounds like you've missed a few classes. How about if you see somebody from campus ministry? That sounds like something that you're struggling a little bit with, is maybe your spiritual identity. So the nice part about that is we are able to collaborate as the provider's confidentiality and ethics allow them to do that. So we are very collaborative, and we do it very intentionally. As you can see, the 4 areas that I oversee, health services is the medical clinic, and the medical clinic here on campus is it's a kind of between a urgent care and primary care. By the time students graduate, 80% identify the health service here as their primary care. This is a time when students are graduating from their pediatrician, or maybe they don't have a primary. We become that for them. The staff is internal medicine, nurse practitioners, psychiatry, dietitian, nurses, I missed somebody else, physical therapy. So it's really a wide range of providers that are available to your student. That part of the service does use third-party billing, so your student would need their insurance card. Anything that is not covered by the insurance goes onto their student account. We're able to take your HSA, those sort of things for billing purposes. So your health savings account can be used in that area. The other part that health services, the medical providers, especially Dr. Marilee Votel-Caval is our medical director, and she is also, as well as all the providers there, responsible for the community health of our students and our St. Thomas community. So they have a lot of contact with the Minnesota Department of Health, with other campus leaders on this campus, as well as University of Minnesota, University of Iowa, University of Wisconsin. If there's an outbreak of any kind at another campus, we know about it, we're paying attention to it. If there's an outbreak of anything on this campus, we're asking questions like an epidemiologist. Are you on a team? Are you in what residence hall are you in? What classes are you in? Because if we're starting to see groupings, we're going to address it in that way. The providers in the clinic are very, very skilled. They have lots of years of experience, and they also have lots of years of experience of caring for college-age students. You know, certainly you can take your student back home to your primary care. That's totally acceptable. The nice part about this clinic is that they are experts in this age group and in the community that they live in. Counseling services is our mental health providers, and we have 8 staff psychologists, 3 doctoral interns, and 3 practicum students. So we have a very robust staff. Even at that, the demands nationally have continued to increase for mental health services for our students. And so we're doing a lot of work with trying to get upstream of that so that students maybe don't need to see a therapist. That might be, you know, if they've not experienced something like a loss, a death, or they haven't experienced a breakup with a significant other, and it's at the same time they have an exam, that may tip them into a crisis mode. And so we're working on a resiliency plan, trying to help students maybe work with peer coaches, other students who've been through this, but also with the lens of, okay, if this student is in need of significant help, we're going to make sure that they get it at the time that they need it. That service there is not a billing for, that is included in the health fee, and that your student will not have any extra charges for seeing a counselor. The psychiatrist is part of the medical group, so that the psychiatrist we do third-party bill for. You'll hear I'm not sure who it is today, it might be Gigi, from the counseling service who'll talk about transitions shortly, and that's one of a team of very talented folks. A couple things about those 2 services, that they're very much tied to HIPAA and privacy. So if a parent or a family member or a guardian calls, we can't share with you the fact that they've even been there. Just as you have HIPAA privacy, so does your student who is 18. If they're 17, we can still have that conversation, but again, there's some limitations within that. You can certainly share lots of information with a medical provider or a mental health provider. That could be very helpful. If you have a student that has been in therapy ongoing for a period of time, it might be beneficial for them to seek out somebody in the community, because this is a short-term therapy model. We don't have the staffing to see thousands of students throughout the 4 years of their college. So the average is about 5 sessions, and so if you think your student is needing something beyond that, they can help you identify somebody in the community that can provide that long-term ongoing therapy. The health services can certainly assist with medication management, and many times we take that over from the primary care or even the psychiatrist. There's information on the website about ADD medications, and how we support students with that diagnosis. Trying to think, I think there's other things. Pharmacy, that question has come up a lot of times, so I wanted to let you know that there is not a pharmacy on campus. The closest pharmacy is about 5 blocks away. It's a CVS, which is in the free ride from public safety to give your student a ride there. We also have a pharmacy that delivers, so we make it as convenient as possible. The third option is they can get on the shuttle, go to Minneapolis, and as soon as they get off, there's a Target there that has a CVS in it. But we try to make it as simple as we can for students. Our health promotion, we have a health educator. You'll hear Bertie later. Will be talking on sleep, which is a really wonderful presentation. And we pay a lot of attention to sleep, alcohol education, healthy relationships, all of the stressors that happen with students, all of the challenges that they incur here. So we spend a lot of time with that. We'll be adding on 2 more staff folks in that area, again, to try to make sure that we are helping students before it comes a crisis to transition into this adulthood. Violence prevention, Emily Erickson is our violence prevention coordinator or director, and she does a lot of work on healthy relationships, understanding and trying to stay true to an individual's values, what's important to them, how do they do that, how do they put boundaries and limitations around the type of relationship that they want to have. And lastly, really thrilled that the university has supported the fact that if we all work together, we can provide much better, comprehensive, seamless care to our students. And by doing that, we'll be moving into a new building. It's a renovated building between Summit, right that way, Summit and Grand on Finn, and it's called the Center for Wellbeing. We'll all be housed together. So as one student said, there'll be no wrong door. Right now, a student may go to the 3rd floor of Murray Herrick to the Wellness Center and think that's the medical clinic, or go to the medical clinic and think that there's a counselor there, or go to violence prevention and think that, there's a counselor there. So we have 4 service areas that are in 3 different locations right now. It'll move into 1 building, 1 phone number, 1 location, and so when the student comes in or calls, we'll help them figure out what they need at the time that they need it. We'll also have nurse triage so that if a student comes in and they have a sore throat, but it's only been 2 hours, it's like, you probably don't need to see a medical provider. Let's try this or that, and then come on back, and we'll see you tomorrow if it needs to be. So we're trying to meet the students where they're at with the needs that they have. Lastly, then, on the health promotion and some of the outreach, there's lots of wonderful things that are happening. And for the student to look at the electronic bulletin board, to look on the websites. We have the Wellness 5K run. There's meditation every Tuesday and Thursday over the Convo Hour, there's no classes then, so from noon to 1, something like that. And many of our faculty have now begun to use meditation and mindfulness practices as they begin their class. And I've actually been in classrooms and observed this, and it is amazing just to see the students' energy level kind of quiet down, be able to focus. Some of our faculty end their class with gratitudes. We know now that acknowledging what you're grateful for can have a significant impact on your health and well-being. So it's not just happening in this center or within these departments, but campus-wide, that we pay attention to your students' well-being. So again, really excited that your student is here. Hopefully won't need to see them in the medical clinic, but if they need that, it's certainly available. So also there'll be folks from counseling, health, and wellness at the info fair. So thank you.
I'm Leah Fulton. I'm one of the assistant deans of students here at St. Thomas and also the parent liaison. So if you email the parent resource email or if you email dean of students email, I'm likely the person to follow up with you. I'll be at the dean of students table at the info fair, so if you have any follow-up questions after this time, feel free to come find me. It's important for us, for you to have a sense of what a care process looks like for students. But before we do that, I would really love to hear from you about what you envision for your student when they graduate. When you come back here upon their graduation, what are some of the skills, knowledge, and abilities that you hope your student will have? I'm guessing you each have some kind of a vision for your student, and that it doesn't include them being a barista or living in your basement. So feel free to shout out some of those things. What are your hopes for your student once they graduate from here? Independence, confidence, passion, resiliency, faith, others, self-advocacy. That's a great one. It's a new one. So maybe a little bit of humility. They still have a lot more to learn. That's healthy. Giving back to society. It's very missional, consistent with the common good. So those are great ideas. And I would imagine that your student probably has some things that they hope for themselves when they graduate. And what we know about the work that we do, so I'm new to St. Thomas. I've been here since April. I've been in higher education for about 10 years. And what I know is that oftentimes circumstances present themselves that can feel like roadblocks to that vision. And my role is to help turn what has the potential to be a roadblock into a stepping stone toward that vision of who they will be when they graduate. So why are we telling you this? Because we want you to know that when they experience those things, we have a process in place that is driven by our convictions, that's driven by a desire to contribute to student success and development. Many of us have our own children, so we're not here to replace you. My youngest child is 3 years old today. So we are not here to replace you. We want to partner with you when needed. But we're going to be driven by our institutional convictions, by development, and being partners in helping students pursue that vision of success. And FERPA. You will be tired of us talking about FERPA by the end of the day. But we want to be clear that when circumstances arise, we don't want to be adversarial, but we want to be honest that we have some boundaries that inform the work that we do. So what does that process actually look like in terms of roadblocks and stepping stones? A big part of that is information can come from a number of places. I work very closely with each of the people on this stage and a number of other folks who you'll meet throughout the day. So parents may contact us, faculty may contact us, folks from academic counseling, so Susan Anderson's team I work very closely with, RAs, resident assistants. A number of people may share information that suggests a student has maybe experiencing challenges where they need additional support. That might mean they're struggling in classes. Maybe they have accommodations right now as a high schooler, and they're saying they really want to come to college and start over and not use those accommodations, and maybe that's not working out so well. Sometimes there's unexpected financial challenges or personal challenges, difficulty within your families and communities that impact the ways that they're showing up in school, making it difficult for them to be fully engaged. There's a number of reasons why a student may come to me and need to be engaged in this process. And while I like to think it's a good process, I also know that sometimes, because students do want to be independent, I think sometimes their understanding of independence means that there's not a value of finding balance between independence and interdependence and being able to say, I want to be able to advocate for myself, and part of that means being able to say when I need support. And so when a student doesn't come to me, is not willing to respond to me, depending on the severity of what's happening, you may hear from me. So I'm always going to, unless there are dire circumstances, my approach is going to be first to reach out to your student, and if I'm not getting a response, to let them know, if I'm not hearing from you, these circumstances are dire, I need to know that you're well, then I'm going to be reaching out to family to get their support and being able to follow up. Sometimes that prompts them to follow through with me, and sometimes it doesn't. And in some circumstances when it doesn't, that might mean I'm inviting you to campus to have a family meeting to talk about what your student needs and what next steps might look like. What I say to students is, I am the hub. If you have a challenge, you're not sure where to go, who to talk to, come talk to me, I'll get you to the right place. that's my goal, is to make sure students get the things that they need so that when they graduate from here, they are prepared not just to live into the vision that you have for them, but into the vision that they have for themselves about what it looks like to live fully and to live well after college. And in the absence of Linda Bachman, who's Dean of Students, I want to give you a few details around a few of the policies that also operate out of our office. The first is the sexual misconduct policy. We wish this was not something we had to think or talk about, but it is. It's not unique to St. Thomas. It's a reality that higher education navigates. Jesse talked a bit about restorative justice and dignity, and that continues to be true for both of these policies that I'm going to talk to you about. No matter the role that a student plays in a situation, upholding their dignity is of utmost importance to us. And so that means not sharing details with people who don't need to know them, and really being shaped by restorative justice and education so that the process is formative and not punitive. One of the ways that we help make sure students understand some of the expectations on our campus is through a required training called Not Anymore. And all students are expected to go through that training. It's an online training. The same is true for bias-motivated incident policies, that there's a training called diversity.edu, also online. We expect every student to go through that. We also have a new online portal where students, any community member actually can report incident bias incident reporting. So if someone's saying this thing happened and I'm not sure if it's a bias incident, they are able to input that information, and the folks will help them navigate that to make that kind of a determination. They don't have to do that on their own. People can submit information there anonymously if they choose, but it also limits our ability to respond if people submit anonymously. Also core, I'm going backwards a little bit, to the sexual misconduct, is knowing that we have a Title IX coordinator, Danielle Hermany, who will work with any student who's experiencing circumstances related to sexual misconduct. And then 3 reminders. The first is tuition insurance. We want to be really clear that the university does not profit from tuition insurance, but it is a resource that helps families be able to recover a greater amount of tuition, room, and board should there be circumstances that lead to your student having to withdraw unexpectedly. It costs about $180 for a semester. Your student has to click a button in their registration process. We've talked about the fact that families don't want to ever think that you would be in a situation where your student needs to withdraw unexpectedly, but it does happen. And what can make that even more challenging is for something like that to happen and to incur the financial loss. And so if you think that's something, if you know your student has mental health needs, or if there are other factors that you think could make this relevant to your family to consider, if it's feasible for your family to consider, it's at least worth having a conversation. The next part is some of the conversations that maybe you've already started having with your students, or maybe you have the opportunity to start having with them around how they're going to make choices while they're here. Choices related to dating and the boundaries that they may want to set in those relationships. Choices related to alcohol and what they do if they're at a party and that's all that is being served. We know that there's a growing number of students who have chosen not to drink in high school and are maintaining that choice into college, but we also know that students in college drink oftentimes. But it sets them up much better to be able to make some sound choices if they've had some of these conversations in advance and they have a sense of what their own boundaries are before they've got to make some of those choices. What we also know is that they want to have these conversations with you. And it may not always feel like it, but they do. And maybe there's other respected adults within your families and your faith communities who they may also want to have those conversations with. So whether it's your drive home or it's being intentional once you get home, we'd really encourage you to be thinking about what some of those conversations are that you'd want to have. What are the decisions that you don't want them to be caught having to make the choice in a moment? And how do you help them start thinking about some of those things now before they're here on campus? The last thing that we want to mention is welcome days. Welcome days is a bit of a continuation of this time. So right now they're getting lots of practical information. Welcome days is going to be much more of a social, communal building time for students. So if your student is living on campus, August 30th is their move-in day, and they'll get a time block if they haven't already gotten it for when they're able to move in. It's based on their last name. You can talk to Residence Life also at the info fair. They'll be next door to me. But the 30th through the 3rd is going to be this community building time. It's really important for students to be there. Parents are not required to be there, but students are. It's not an optional time. It's giving them the last bits of information they need to be able to start well on the first day of school of the semester on September 4th. So I think that is the last item that we have for you all. And like I said, any questions, feel free to stop at info tables. Some of us will see you at the reception this afternoon. And thanks for your time. Oh, yeah, we can take some questions now. Thank you. Sorry, I missed that part. We can take some questions now if there are any questions.
Not soon enough. No, it's right now slotted for November. So, which is a, we're so excited, but it's also a very busy time. That's the height of flu season. That's the height of stress time. So we're working now with looking at a phased move over, but in November is our goal. Yeah, that's a good question. So the Center for Wellbeing will be open in November is our current hope. It may be pushed back a little bit. It's hard to say. Other questions? You will also be getting an email, or your student will, about immunizations. We currently are getting a data dump from Minnesota immunization system. So if you're from the state of Minnesota, your student will get an email saying, oh, you're good to go, we got all that we need, or you're missing something. With the folks that are from out of state, we don't have access to those other data centers, so that's your student will be receiving saying the state of Minnesota requires MMR 1 and 2, and then a recent tetanus. And that's entered online. There's no paper form that's required. So that'll be coming shortly. Other questions? No? Okay, you'll have a few minutes, probably 10 minutes before the info fair. Josh, were you going to talk a little bit? So hang on, I'll give you more instructions.
Let's thank our panelists one more time here. Thank you all.